Hi everyone, today is the 10th of March 2025. I'm here at Loxford Polyclinic for a GP appointment. I spoke to the GP on the phone and told him about the blood and urine I've been having, and it's been ongoing now, and all of you are aware about my pains in both of my kidneys and the surrounding organs, which happened because of the poisoning, and they've been trying to get away with it now. So yeah, let's go in and see what they say. And they're just finding excuses to cover this up, and the police have not done anything about it as well, as you know, not even a single follow-up, which is my right. But yeah, let's go in and see.
May I check please your date of birth, Mr. Rimmer?
Yeah, 17/01/99.
That's on the address, please.
20 Nataro.
Yeah, for the right address, right date of birth. So I see you had the scans done, yeah?
Mm-hmm.
So the ones from the 6th of February, so the scan I think showed you had a cyst in the kidney, yeah?
Mm-hmm.
And it has some bleeding inside it, yeah?
Yeah.
So you mentioned, yeah. So
According to them, that's what they've said.
yeah, so the hemorrhages occur, that'll normally heal within a month, So the body has a healing process, will normally clear that up within a month. So the repeat scan will often show that it's healed and there's not as much of a problem. So a further scan done, I believe, yeah? Repeat scan 22nd of February. So this was...
So then I've had an
February.
ultrasound done, which they suggested, that Hendon Hospital suggested as well to get done.
Yeah, cyst is still done. Yeah, so
And they said there's no hemorrhage.
yeah, because as I said, it'll heal. It's just if you have a bruise under the skin, it heals within a month. That's expected.
But that's not the case. With the pains in my body, in my left and right kidney,
Yes.
that is completely destroyed. It has been in complete pain. Not just that, my like the upper abdomen,
Okay.
where my liver is,
let's
and the
discuss-
spleen
let's
has also been in a lot of pain.
discuss that in more detail. But there's no other disease detected. Yeah.
So look,
So
over here, this was done with contrast, right?
yeah.
Yeah, and they did not even speak about anything about a mild fatty liver.
Yeah.
Yeah, and on your ultrasound, they talk about a mild fatty liver. Like the reports that I've been getting from the NHS and the private hospitals do not match each other, and there's a lot of inconsistencies that.
Yeah,
so,
reporting will be different. That's what they mentioned here. It's mild fatty liver change. So it's not, so nothing so worrying or too serious. But the cyst on the kidney is still there.
So
That's
that's the thing. You're going by what is on your screen.
Yes.
But for me, I've been in a lot of pain. I've reported this to the police.
Yes.
So I believe, I don't believe, I'm sure now that my results, all my scans and reports are being fabricated
Yes.
to cover up the truth about my true conditions.
Yeah.
And like I've mentioned to you, for me, I've done everything I can I've gone private hospitals. They keep on finding new problems. One time there's
That's expected. Let me explain to you.
then they're like, oh, it's
Let me
hemorrhage.
explain to you. I'm 60 years old now, yeah? And I'm not going to live forever. I'm going to get old and die one day. I've got several illnesses, just like you have. So you're only young, you're only 26. In the next 40 years, you'll get illnesses. That's expected, Your body will change every decade. By the time you're 55 or 60, like a lot of people that we see who have a heart attack or a stroke or other illness, that's expected, So that's as your life progresses, So by the time people are 60 years old, most people go, oh, I'm getting older, my hip hurts, my knee hurts, I take paracetamol 3 times a day, So this happens as you get older, So it's expected. And as you get older, you'll get more illnesses, So your body now is different from what it is in 10, 20 years' time, Unfortunately, people that are 55, so often have a cancer or a heart attack or other illnesses. So that's not surprising, that's expected. I'm not going to live forever,
That's fine. I'm not going to live forever at all.
Yeah,
I'm
so
not
if I
saying
could live
anything
to
like
the
that.
age
What I'm
of
saying
80
is,
with health.
do you expect a person to be in complete pain for
No.
the past couple of years?
Well, the pain
and
that
your
you're
scans-
having is worse than with exception. This is a tiny cyst. This wouldn't cause this level of pain.
Yeah,
so
but
let's find out more.
The cyst is in the right kidney. Why is my left side,
Yeah, so
left
let's find
kidney
out
and
more
my
then.
spleen,
Yeah.
my liver, like the
Okay,
whole
so
abdomen
let me
has
go
been
on
in
and
pain.
find out more. So for the tummy then, for symptoms of tummy, at the moment have you had any vomiting or diarrhea or bleeding?
I've had vomiting, and I've also
vomiting today, or when was the last time vomiting?
recently, couple of days ago.
Right, okay. Any
also-
diarrhea at the moment?
No diarrhea.
Any blood in the poop or vomiting of blood?
I've reported a couple of times that I've had blood in the urine,
Yeah.
and I've done.
Is it red blood?
Yeah, I've shown the proof to the GP as well
Yeah.
when I spoke to them previously, and
you know.
So we've done a referral to the urology team. Yeah, so referral's been done, I believe. So urology.
Yeah, but no one's called me. It's
Well, they won't call it.
they suggested they want another
24th of February.
another MRI done. The doctors I spoke to, they said they want another MRI done.
Well, the hospital doctor.
No, the GP here. I spoke to two different.
The
GPs.
hospital will decide. The hospital will decide. So I see you spoke to my colleague, of course, 24th of February, MRI scan, and she's done a referral to the hospital urology department. Yeah. So there's no cancer detected. I mean, you're in 22 for cancer.
You're only going by what's been shown onto your screen. That's fair enough.
Yeah.
Like, these are the reports that you're getting back, and you're doing everything you can as a GP.
But
for me, I've explained.
Well,
to you my
in that case,
concerns.
my view is that you're paranoid. Okay, you're not.
Oh, no, there's no such thing as
logically.
paranoid.
No, I disagree with you. I disagree with you.
I went beyond to get every single scan and
No, the
everything done,
NHS,
and now
no,
I've
the
reported
NHS
that.
doesn't do that. The NHS doesn't do it. It's not like India or Pakistan. You pay $1,000 to get everything done. We do the 4 or 5 tests the NHS government pays for. We don't do everything. You know, with the common problem with people coming from other countries. Although in India, you have 100 blood tests. You have to pay for it. It's not free. The NHS is restricted. Yeah.
For me, I've done the scans privately. I've done them with the NHS.
Yes.
And the thing is, this is what I'm telling you. The reports do not match.
Yes. Well,
I found the
we'll see with the hospital. I've explained to you, not listening, that if it's a bleed in your cyst, as I mentioned here, it'll normally heal in a few weeks.
So will it not show up on my ultrasound?
No, I want to show you this. That if it's blood seen in the cyst, if it's healed, it won't show up anymore. Well, it's gone, isn't it? You know?
I reported before I had the scan done. I reported this to the NHS that I had blood in my urine.
Yeah.
And their scans come back.
Well, that's what
Apparently
we refer to the hospital specialist. The hospital will do their investigations. They'll normally offer you a telescope inside the penis, look inside the kidneys and bladder. Yeah. At the age of 26, we'll be very surprised if they find any disease. You're too young, very young for
that's the thing.
worrying.
You know, like I said, because my reports have been fabricated and they went beyond, and now I've managed to track down how they managed to do that. The thing is,
well, I'd say that's incorrect, and I say you're paranoid. Okay, that's my personal view. Okay,
that's your personal view. But
I
have all the evidence to prove it. That's the thing.
Yeah, so that's why you have your thinking. Now, I see the psychiatry unit sent you a letter.
That's fine.
They weren't able to contact you from the psychiatry unit because this is paranoid thinking, in my view. Melmead has psychiatry unit sent you a letter 7th of March. They said you weren't interested.
I'm fine with that. I've reported this to the police.
Yeah.
I've multiple times. They haven't even got back to me once, which is
they
right.
won't, because it's paranoid ideas.
It's not.
You feel you've been persecuted and victimised incorrectly, in my view. You know.
So this is what I'm saying. If someone murders you through poisoning,
it's not what you request.
And they will get away
it's what the
by just saying you're
qualified
paranoid,
doctors
you're crazy, you're
who've
insane.
done 20 years of training will say we have logical scientific evidence for.
That's fine. Like I said, you're going by what's been shown to you on the screen.
Yeah.
And like for me, I've explained to you my concerns.
Everything
I've
you
been
say,
in a lot of pain.
No, everything
I'm
you say
losing
needs
my
written
ability to walk
evidence.
properly.
So what painkillers use at the moment? Paracetamol, what are you using at the moment?
I don't take any painkillers.
Well, that's daft. You need to expect to use from the paracetamol or from any pharmacy, okay? Otherwise, are you silly or something?
But I've got blood in my urine now.
Yeah, the hospital look into that. But in terms of pain, you need to use...
Both my kidneys are destroyed and the surrounding organs.
Well, again, the scans don't show that, okay? So you're saying that's scientifically incorrect. Now, you expected, any nonsense, paracetamol from the pharmacy. If you haven't done that, they're a bit silly and daft. You need to get paracetamol or painkillers, paracetamol, neutral, whichever painkillers suit you from the pharmacy. They lost you in blood for 6 hours. You take them every three or four times a day, just like I do. I said I take paracetamol 3 or 4 times a day. You know, that's quite common. At my age, I'm old.
For you, that might be.
So may I take a look at your tummy and examine your tummy?
Yeah, sure.
Okay, so let's examine you. You have blood in the urine. Any temperature at the moment? Any
no
vomiting?
temperature.
No. Let's take a look at your tummy. Please look at your tummy. Yeah. We've only got 5 minutes, so let's examine your tummy. Make sure there's no lumps or bumps. Have you had any previous scars or operations on the kidneys or tummy?
No, nothing at all.
Thank you, please. Thank you. Next to the skin on the tummy. And get breath. Breathe. Get breath. Breathe. Any pain when you breathe? Is that sore? Does that hurt you?
I've got pain both sides.
Please relax your arms by the side. Thank you. Please relax your arms. Gentle breath, please. Deep breath in that for me. And again. Your muscles are quite firm. Do you just sit up so crunches?
No.
No? The muscles are quite firm. There's no lumps or bumps. Your liver's not big, your spleen not big. There's no lumps or bumps. Kidneys don't feel big. You're quite muscular. Normally people have that muscles are like the sit-ups or crunches. That can cause pain in itself. You don't do any sports?
No, nothing at all.
Thank you. Please get down that. There's no lumps or bumps. Thank you.
Like I said, it's not visible to you right now, but internally there is a lot of pain.
Thank you. May I check your pulse and temperature?
Yeah, sure.
So if you may I check your pulse right at the wrist, please. Thank you. So if you have pain, you need to use logical size of painkillers. Please straighten the hand for me. Check your finger level. And may I check your temperature in your ear? Make sure your temperature's okay. You mentioned no particular feeling hot or temperature. You mentioned no. Okay. Let's double check that. The temperature check. Excuse me. Thank you. Thank you, temperature normal, oxygen levels good. That's fine. Normal numbers there. So thankfully there's no lumps or bumps there. So we're really waiting for the next stage of the hospital expert's opinion. The referral has gone off, so I'm really sorry the waiting now is at 3-4 months, you know, because the junior doctor strike last year's delayed everything anyway, you know. So we'll have to work the hospital urology team, when they have an appointment, they'll normally write to you in the next couple of months, and these are the hospital experts. If you're concerned, what they'll normally do, if blood in the urine, is put a telescope into the penis and take a look inside the bladder and inside the kidneys. Yeah.
But if you have a look at like what I've told you all along,
Yeah.
if my scans have all been fabricated,
Yeah.
and you know there's someone covering up the truth,
Yes.
why would I? And you know I've been in a lot of pain for
Well,
a long
this
time.
is-
I've
this
been
is-
chasing up my GP.
Yeah,
I've
this is-
been
this is-
getting
well,
stuff.
you're- well,
why
I'm-
would I trust anyone to start doing a surgery just to
They don't do-
you know go fix
Well,
me and then get away with it and everything?
They'll offer it to you. You can always say no, yeah. But then they can't help you. They'll
That's
just
fine.
say,
So,
you know,
so just to see, you know, like I said, they only suggested like
Hold on,
there's
sorry
a
if you fell.
yeah. So they only said that they are there's a hemorrhage in the right kidney and a
Yeah.
simple kidney disease. But what about my left one? Which like I said, I've been having pain in both. And
There's
my liver especially.
there's no further lesions, no other abdominal lymph nodes, liver bills are all normal, nothing else. So what you're saying is illogical. There's no, so that's a copy for you. You've got a copy already.
No,
There's-
I've got a copy.
The other,
You can keep
the
that.
other organs have been checked. They're normal. They normally scan the whole area. You see,
Yeah.
the whole area of the abdomen. So I think what you're saying is illogical. There's no other. Now, if there's no physical disease we can find, a tiny cyst wouldn't cause that level of pain. As I
That's what I'm
explained, well, again, then most doctors say this is not physical. This is psychological. You know, so there's no physical disease. We think this is psychological pain. You know, so again, that needs a separate discussion if it's really stress or tension or psychology related.
No, like psychologically.
So,
I'm-
our job is to refer to the
strong.
hospital specialist we have done, and obviously, let's see what the hospital experts say. Yeah, they'll normally offer investigation for you if you're having bleeding. You're welcome to say no, of course. But then they can't investigate further. You know, at this stage, we've got a detailed scan. So further scans in general won't help. At this stage, so we'll see what the hospital experts say. But their job is to offer operations and investigation.
That's the thing. The last two GPs I spoke to, the one that booked me this appointment
Yes.
and the one before, she suggested that they're going to do another MRI.
Well, they
with
may do. They may do an
the,
MRI
NHS.
scan. They see if there's any change. The scans are usually reported in a standardised way. So I see little benefit myself.
So from your end, you don't want any blood test,
Have
any
you
urine
had
test
blood
done?
test? Have you had blood test done recently? The one in January, I see. You had a urine test
Mm-hmm.
in January. So 2 months ago, liver chemicals, kidney chemicals were normal. Hepatitis blood tests, HIV tests were
But
done.
if we look at the urine test that's done with the NHS and the report that I got from Hendon Hospital later on,
Yeah.
your urine test said that they did not have any blood or any creatinine or anything, compared to what the Hendon Hospital said something different.
Yeah,
So,
well,
like,
really,
there's-
this urine test is a bit poor. It says sample. So they made some kind of mistake.
Yeah,
sample
so
booked
there's
in
so many
error.
times that I've given a sample in and then they said sample error. How is that possible? I know that before I even sent it, I took pictures of it. The way I labeled it, everything was correct, and somehow still
Did you hand it in the box here? At
in the box
reception?
here, yeah, they just come back with me sample inaccurate or whatever excuse that
Yeah.
they find.
So the hospital decide what further tests they want to do. You mentioned at the moment any pain or burning in passing urine or temperature at the moment of infection.
No, it's it's normal. It's just that I've been tracking it down and blood is
You've
coming
noticed,
out.
okay.
Yeah, a couple of times I've taken a picture of it. I've shown it to the GP
there's several
before.
diseases that cause. There's no cancer or lumps or bumps. Sometimes there are kidney diseases that can cause bleed in the urine, like nephritis. So the hospital check for those. Check for any. Is it a history of family of kidney diseases or problems
Correct.
in the family?
My dad had a transplant. It's been
Right.
a while now.
Was
but
that for kidney disease?
For
And
kidney.
was it for a kidney failure?
chronic kidney failure.
Yeah, so they'll check for that. They'll do their job. They'll check for that.
That's what I'm
you know?
saying. They haven't done that, and for
Yeah,
me,
well, that's
I've
the
been
uro-
in
the
a lot of pain
urologist
for a
will
very
check
long
that.
time. I'm not just saying now.
Yes.
And it's not psychological because I've been chasing it up. I've been going down, getting it
So it's
down.
been over 6 months.
And
of
that's what I'm
pain.
saying now because I don't have my reports all on me now, but I've
The
collected
reports
all
from Pakistan or
from everywhere, from
Yeah.
not just in this country but in Pakistan, and the MRI done in Pakistan said nothing about no kidney cyst, nothing at
Yeah.
all about myelofibrosis. It was a clean report saying there's nothing wrong with you.
yeah, was that from last year or
For this last November,
November? So that's just 4 months ago. Yeah.
just 4 months ago, and
Yeah.
my previous report
Yeah.
suggested
So
a
then-
kidney
then-
cyst.
then maybe-
So like
that-
they tried to replicate the report.
Yeah.
like all my previous MRI that I've done privately in the UK.
Yeah.
But in Pakistan, the report was clean, and then come back to the UK, the
It
kidney
may be-
cyst is still
may
there.
be poor
This is what I'm
reporting.
saying. There's something to do with the DICOM files, and there's a lot of fabrication that can happen if they're targeting a specific person to cover up whatever.
Yeah, I find no written evidence.
Obviously,
on
for me, like I said,
here.
as a GP, you have done everything you can. You have suggested your reasoning,
Well,
and you have passed it on to a
we don't know
urologist.
referral to the hospital, but see what advice they have. So I'm sorry, I don't agree that there's a cover-up, so to speak. The bleeding of the cyst will heal, as I explained.
But for
Usually
me,
in
like
2 to
I
4
said, I've
weeks.
been in a lot of pain. I've
Yeah,
been unable to walk properly now as a normal person, as a 26-year-old. I'm a very active guy. I'm a IT engineer.
Well, but active for me, active means doing swimming, cycling, jogging, dance,
No,
aerobics, tennis.
I haven't been able to do that. That's the thing.
Yeah.
I haven't been able to.
So what is
since
it
my
active?
condition.
When you say active, what do you mean? Physically active or mentally active? What do you mean? Because that means different things.
I mean, I'm an active person, as my day-to-day routine when I was working, and then once this condition started to appear,
Yes.
I went to the GP, I went to the private hospital,
So you're concerned
and I started to keep up to date.
Yeah.
Only because I've kept up with them. Meaning
Yeah.
by now I would have lost hope. I would have.
So you're
a lot of damage would
concerned
have
on
been done
kidney
if I
disease
didn't
like
keep
your
up.
dad. Is that the concern that you have?
No, it's not a concern. I'm sure now, because if I did not keep up, do all these tests privately
Yeah.
and with the NHS, a lot of worse things could have happened.
Yeah.
It's just because I've kept up with all of this. Obviously the damage that they have done is already.
Well, who's done the damage to you?
That's the thing. This is why I've reported it to the police. I've reported it to the.
Well, has anyone done operations on you?
No.
So
The only operation I've had is.
So whom are you blaming for doing these supposed things to you?
I mean,
It's not logical what you're saying.
there's a lot of things to it. Like
Were you beaten up or hit or whatever?
No, not beaten up at all. It's like I said, what I believe it was poison that
From whom?
that I don't know.
Here in Pakistan?
First, it happened in the UK, and then since then, my conditions started to get worse, and I was working as an IT engineer.
Were you a Pakistani spy or UK government spy or anything?
No, I'm not a spy at all.
MI7 or?
No.
Okay. So,
not
so
at
we'll
all.
leave that.
Do you really think at 23 at that time since it began in 2021 when I noticed these things, I chased it up with my GP, got a blood test done, everything like a regular person.
Yes, yeah.
And since then, it's been ongoing, and my conditions only got worse.
Sure.
Where
Well,
my
so-
left,
well,
right
let's
kidney,
and
the surrounding organs.
I hope it's nothing worrying. That's what the hospital experts say. At this moment, there's no.
I mean, they're making me go around and around until, like I said, until I lose my hope.
Well, have you seen a hospital urologist yet?
I seen some guy before out of the hospital, but not a urologist.
No,
I
it
think.
needs to be a specialist urologist, yeah? So if the A&E doctors aren't as well trained, like I'm trained in 5 years in general practice work, but I've got no expertise in urology, So like a heart specialist focused on the heart. So you want a specialist doctor in urology, we're doing a referral for you.
No, I completely understand.
Let's see what the
From
hospital experts say.
what
Yeah?
you...
It does sound a bit odd and strange, as you explained. Please use logical scientific painkillers from the pharmacy. Any pharmacy's got paracetamol or Nurofen, whichever painkiller suit you at best, or there's cocodamol, We have really strong ones, but the very strong ones, like the strong cocodamol, they can cause often pain,
I mean, if you
vomiting.
need if you need surgery for the pain, which I'm sure about, would you take painkillers and
it's not
make that
a
go away? You
surgery.
can't.
You need painkillers. I said they're talking investigation. Investigation is different from operation. So investigation, normally if there's bleeding, they're considering a telescope look inside with a soft plastic telescope. So that's not a major surgery or operation. You can recover from that in a week or two. I hope they find nothing worrying or serious. Scans are no other worrying disease. I said there are other kidney diseases they can look for, which is a hospital specialist's job, Let's let them do their job, look for anything worrying. Sometimes they'll say, oh, well, we can't find anything worrying here. Refer to a kidney specialist, which is different category of specialist.
No, I completely understand that.
So
I've seen how it happened with my dad and everything.
Yeah, so we'll wait for the
for
specialist.
For me, like I said, after seeing all the reports, comparing them and everything, they do not match, and there's a lot of fabrication that happened, which
so
now because of all the evidence that I have, they've been caught out. And like I said,
I can't comment on scans in Pakistan, the reports done there. The comments, the scans in the UK, I hope they're reasonably consistent. This is from the cyst, etc. Again, we work with a hospital specialist urologist to assess. If there is a damage done, and as if it's a healing process, will not take 2 to 4 weeks. So just like after a bruise on the skin or a bruise, it'll take healing for 2 to 4 weeks, assuming your body's healing, you're eating okay, good nutrition, etc. So the hospital urology will look for any worrying or serious disease, and they'll advise us. And the other group, as I said, they may advise is to refer to a kidney specialist rather than doing surgical operation, you know. So let's see what advice they have. We'll have to wait for the letter to come back to explain.
But that's fine.
Yeah?
Do you know how long it will be? Because
Well, the waiting is normally at 3-4 months of waiting time.
That's what I'm saying. Like, do I have 3-4 months before my conditions get even more worse, and then?
Well, any emergency to go to A&E. Otherwise, it's a routine. There's no cancer or anything worrying there. It's a routine referral.
It's a bit ridiculous because, like I said, I've reported this to the police. They haven't even done any like.
They won't because they'll think you're paranoid.
Without speaking to you at all.
Pardon?
Without speaking to you.
Who? Police?
Yeah.
Well, they're welcome to their opinion, but they have to get your signed consent for access to your medical records. You have to give them signed consent. Others have no permission to access your medical records.
But let's say I've complained to my GP multiple times. I've complained to the police multiple times about this and everything that I'm going through. Is it not fair for someone to follow it up even once?
No, if they think if they think you've got a psychiatric problem, a mental health problem, and it's excessive anxiety.
How can you suggest that? Like without speaking to the person?
If there's no physical disease, then I say most of this is psychological.
So, like we said, the reports have been fabricated.
Well, again, I disagree with that.
There's a lot of evidence.
We're going in circles here. I need to stop this. Our next patient's waiting. Okay, so we're going in circles here. In some of the urology referral has been done. We would wait for the hospital urology team to review you, see what advice they have. Yeah, for me, and for as I say, this sounds like paranoid ideas to me. You know, most of our patients wouldn't go to the police. You know. For health problems like this. As I've explained already...
My one is more than a health problem. What I need is surgery to resolve my issues. And
who said?
I've been battling...
Who said? A hospital urologist?
I'm telling you, because everything I've been through, I'm telling you, because you're going by the reports that's on the screen.
I hope you don't need operation or surgery. That's a quite major thing, you know? So
I know because of my conditions.
I hope you don't need major surgery.
I'm doing whatever I can for my survival.
At the moment from the reports I see, there's no need for major surgery for you. And obviously, surgery in itself is quite distressing and upsetting, you know? And it takes the body 2 months to heal afterwards. So I don't wish that for you, you know? So let's see what the hospital experts say, yeah? And we'll have to wait for their letter to come to update us. You know, I'm sorry, the waiting time is about 2 or 3 months normally, so we'll wait for them.
That's fine. If you can, put it mark it as urgent.
No, they won't mark it. It's not a cancer referral. It'll go routine like everyone else. I'll add you then to the waiting list. Yeah. Okay.
That's fine.
So we can't tell forward to live patients. If it's routine, it's routine. You need to wait like everyone else on the waiting list. Yeah. Okay. You need your phone.
Yeah, I'm gonna grab it.
Sometimes people leave their phones, you see. So.
No, don't worry. It's Alright, perfect.
Okay.
Thank you very much.
So we'll have the hospital contact. That's fine.